My name is Elizabeth James Limp, and I'm a retired farmer's housewife.
Grandma Limp had taken, and we call her Grandma because I have her permission to call her that because she became our hospital grandma.
Mom and Dad, Liz and Harold Limp, they just loved their grandkids. They followed everything they could and went to as many of their games as they could and their activities, and just were just wonderful. And they had a great marriage, and they had just celebrated their 50th anniversary a couple years earlier.
My husband and I decided to go to our older granddaughter's softball game, and that was held in Central City. And we went up there and had a nice evening with some neighbors that were there, and just a real fun evening. And Michelle was doing good on first base, and all of a sudden they called the game because they saw lightning. And so we began to amble over to the pickup, and a wind came up, just fierce wind. And we drove, had got a little bit east of Central City on Highway 30 going home, and it began to hail. It hailed so bad it was like a whiteout blizzard in the wintertime. And my husband said, "I can't see the road." And I said, "Well, you better head for the ditch." And the next thing I remember hitting the truck, not knowing what it was, didn't see anything.
And a friend of ours called. Her daughter plays on the same team with Michelle, so she called from that game, and it was one of those kind of scary calls. She says, "Sue, do you know where your parents are and where your daughter is?" And I said, "No, why?" And she said, "Well, there's been a really bad accident up here, and I thought they were ahead of us." And so that, of course, made me get on the cell phone quickly, and I got a hold of my daughter, and she was fine. She had gone with friends, and I couldn't get a hold of my mom.
And then the next thing I remember, I came to, and the rain was hitting my head, and there was a person holding a flashlight and looking down, and I remember saying, "We're hurt down here." I felt like I was way down, far from the voice and the flashlight. And I think it was a man, and he said, "Hold on, can you hear the ambulance coming?" He said, "It's coming now, and it'll be here in just a minute."
We just saw the scene, as we came up on it, we saw the scene. We got out. Of course, it was raining still. Robin and I went up to the vehicle first, and both sides. Tried to get in. We noticed, we're unable to get into the vehicle, so we knew we were going to need help. They called back for the second unit, for fire to come out, for the Jaws of Life, and for the hospital to call code trauma, because we knew how seriously injured they were. Probably the one thing that Robin and I both remembered from the scene was when we came up to the vehicle and looked inside, they were holding hands. That was kind of, something that we both kind of remembered from that accident.
We did a rapid extrication C-collar and moved her onto the board because, again, it's still raining hard, not as hard as it was prior to it, but it's still raining very hard.
I was concerned with her breathing, the way the seat had buckled and was positioned. She was in a forward bent position that was not comfortable, and she was having a hard time breathing.
Not too long into the ambulance, and we were doing our assessment, and she started to communicate with us, and we were asking her questions about her pain, her medicines, her allergies, and you take any medications, Elizabeth? And no, my husband does. He's on Coumadin. Get on there and tell that other ambulance that he's on Coumadin. And she wouldn't give us any information on her. She was more worried about her husband. Yeah, don't worry, your husband's in he's in good hands too. I need to know. We'll let them know that when they get to the hospital here.
And then just a couple minutes later, the phone rang back, and it was Mom's phone. And your first response was, "Oh, good." So she called, and so I answered it, and it was somebody from the emergency room in Central City, and she told us there'd been an accident, and we have your parents here, and you need to get right here. So, it takes your breath away at that point, but you don't know how bad it is, so you just okay. So, my husband and I raced up there, and found it was very, very serious when we got there.
Her and her husband both came in. Mrs. Lemp was talking to us. She was giving us information about her husband. Initial triage was actually worse for her husband, and so a lot of our resources went to her husband at first. She completed her initial assessment with just some left-sided chest discomfort and some blunt trauma from the accident. But other than that, had a Glasgow Coma Scale of 15, and really was imperative of giving us information about her husband, who was on high-risk medicines such as Coumadin, and she was doing well. Elizabeth went in to get a head CT, head and neck, just to clear her head and neck, so we could get her neck brace off because it was quite uncomfortable for her. When she arrived out of CAT scan, we noticed that she had a massive amount of subcutaneous emphysema on her left side of her chest. She also started complaining of shortness of breath. During the course of the next 10 to 20 minutes, her consciousness went way down, and so did her blood pressure, and we ended up having to intubate her. After we intubated her, her oxygen saturation continued to drop, and so we had to go back and reassess, and found that she had a tension pneumothorax on the left side. We were able to decompress it with a needle and place a chest tube in, which had a massive amount of blood came through the chest tube, so we know she had a hemothorax. What we didn't know is that she also had a diaphragm compromise, and that her diaphragm had ruptured, and so putting the chest tube was able to relieve the pressure on that side so that we could oxygenate her better. We're not used to putting in chest tubes in the ER every day, but because of the training and because of staying up to date on advanced trauma life support, because the nurses are up to date on TNCC, we were able to do some of those things.
Well, everything, we are trained for trauma, so when one comes in, we are ready for it, but it still feels like total chaos when you do have a trauma patient there, but everything actually worked well that night, and everybody worked well together, and we were able to keep her stable enough for transport.
When I received the call, we talked to Dr. Bulke from the hospital in Central City, and it was very evident that there was a very devastating crash that had occurred. They were working feverishly with Mr. Lemp, and Dr. Bulke was telling me also about Mrs. Lemp a little bit later. She initially had been stable, which can happen with patients that have lung injuries until air gets under pressure and until they bleed out. And initially she had been a little more stable, and then he called in with a second call stating that she'd gotten much worse, that they had multiple respiratory difficulties, and that they had to put tubes into her chest, and that she had flail chest and ribs that were broken, and that the abdomen was getting worse also. So Dr. Bulke sounded the alarm very early that Mrs. Lemp was in trouble, that they had done everything they could, and that they were rapidly trying to get her to the trauma center. The extent of her injuries was massive. She'd taken a huge amount of energy transfer to her body. With a ruptured diaphragm, the spleen was ruptured, the heart was ruptured out of the pericardium and was laying in the upper quadrant, or was in the upper quadrant, or the upper quadrant was in the heart area. She'd also Her abdominal cavity had been wrenched in such a way that she had ripped all the way down into the inferior vena cava, which is one of the major vein coming up from the rest of the body into the heart. And that took quite some surgical manipulation to fix that. Survival from a blunt inferior vena cava injury is not very good, because to get that amount of injury, the energy expended to the rest of the body is just massive.